VBC Plus Solutions is pleased to bring you the VBC Exchange, where our host, Sean Garcia, explores the world of value-based care. Together, we'll meet industry leaders and innovators working to enhance patient outcomes and transform healthcare delivery. Let's get started.
Hey, Rocky.
Hey, how's it
It's
going,
good,
Sean?
good to connect with you. And I want to welcome you to the VBC Exchange.
Well, thank you, Sean. It's an honor to be here.
You know what? I'm really happy that we had a chance to connect because you're part of Troupe Health, and that that's part of our Miniseries. And I'm always going to start you all off because I want to introduce you all and all the work that you do to the community. So tell me about yourself, Rocky. Start there.
Thank you, Sean. I'm Rocky Samuel. I am a emergency physician and primary care physician, and my career passion is driving care out of the hospital and into the home for our patients. As much as we can focus on patient-centered care and true value and really looking at the place of care as well, that is something that I love to do. At Troupe, I'm Chief Medical Officer at Troupe, and I'm also a primary care physician at Troupe. So it's great to be able to drive value-based care into assisted living for residents and for patients that truly need it, that have real disease and really heavy health and mental health burden. That is my passion.
Well, I'll tell you what, that aligns really well with as we describe value-based care. So, you shared one time, I really enjoyed how you spoke to me about value-based care in simple terms, and you shared a story with me. So I don't know if you can do that now or if you want to do that, but it'd be great if you did.
Yeah, it's funny. There's a lot of misperception about value, but I have a simple brain and I like to think about things simply.
Not just you. I do too.
Right. If you think about value, you got to know sort of where we came from in healthcare. And, quite simply put, if we go back millennia, right? If we go back millennia, right? And I'm Egyptian, so I like to sort of think about the pharaohs and the pharaonic times when there were doctors and medical workers back then. Someone would get sick, go approach one of these healthcare providers and ask for a service. The healthcare provider would provide a service and get paid. And then that person would leave. They may get better, they may not, but then they get sick again. And they go to that healthcare provider again. And that healthcare provider gets paid again. And the more that patient gets sick, the more they're paying to that healthcare provider, right? We're truly paying for illness. Whereas value flips that script. Rather than paying for illness, right? Paying when we get sick over and over and over again and more as we age. What if we paid for great care that kept us from being sick? That kept us from suffering, that kept us from poorly managed diseases, and kept us from needing to go to the hospital. That makes much more sense. It's surprising that it's taken millennia for us to get here, but that's how I think about value.
I really like that story you shared before. I just thought it was really telling of how long things change. And that I always have my 5 principles of value-based care. Change management's number one. We'll dive into that later on in the mini-series. But to your point, I found it interesting too, being in this space, that there are a lot of definitions of value-based care. But I think the most fundamental that I want to share with folks is it's just really quality over cost. And that I would also mention too, because you made a point previously when we were having a conversation, was I'll mention something that it's not. And I share this from experience, having gone through the process of transformation with a couple of different organizations from fee for service to value. Is value-based care is not managed care. And I say that because when I've had many conversations with health plans, and as I speak to them, even through the change process, I tell them that I say it's important to remind them that value-based care, as we discuss it, when we're thinking of quality over cost, is not reducing cost by any means necessary, right? And I think I want to make that distinction where it's number one, it's not managed care. Anything else where you think that maybe VBC is not?
Right. It's also not just doing a good job, right? There are plenty of good providers that are well trained, that are doing, a good job, quote, good job, but not necessarily from a value-based perspective, right? We're both physicians, Sean. We enter this profession truly to help our patients with their suffering from illness. And there are plenty of folks out there that are not plenty of providers out there that are doing a quote unquote good job. They truly do care about their patients, but value has not entered their practice or the way they operate or the way they think about caring for their patients. Fee for service is just like that story of that pharaonic medical provider. And the great majority of providers today are practicing fee for service. And I do believe that the great majority of fee-for-service providers ultimately are good providers practicing great medicine, but value-based care is different. It's more than just be doing a good job. It's really changing our perspective, changing the way we deliver our knowledge, our care to our patients.
Yeah, that's a great point. I want to get more specific about for a moment around Troupe Health. And I was introduced to Troupe Health because in my expertise as a value-based care transformation person, I get to work in different sectors of the healthcare system. And you have been in this space for a while now. Can you tell me a little bit more about what are you hearing about value-based care? Are you even hearing about it? Is there a need for it? Tell me more about your space.
Sure, sure. Let me start with the senior living space, right? And the senior living space, it's a fascinating space in the fact that, when you look at senior living, when you look at assisted living and senior living, there are residents there that have heavy needs and heavy medical needs, heavy mental health needs. And if you take it as a population, the residents in assisted living and senior living, they tend to have higher costs because they have higher burden of illness. But in an assisted living facility, though you have phenomenal caregivers that break their backs, assisting with making sure residents are safe, assisting with their activities of daily living, like food and showering and so forth. They're regulatory wise, there is no one mandated to be in the assisted living that has medical training. It's not required that there's a nurse there. It's not required that there's a physician there. There may be outside medical professionals that come and round, but we know that things happen between visits, right? Things happen at 2 o'clock in the morning and on weekends, right? And not necessarily during the 9 to 5 of Monday through Friday. And because on one side we have residents that are getting sicker and sicker year by year, right? They're coming into assisted living later. They're staying there shorter because they're coming in later in life with more disease. And the staff hasn't changed. The caregivers, they do a phenomenal job. Do not have the medical training. So there's a gap. Higher medical needs and mental health needs for residents. And the assisted living, though they do a great job with the activities they've been living and keeping residents safe, it's not a healthcare facility. It's not a hospital. And so I'll tell you, there's an assisted living by my house. And the only reason I know it's an assisted living and not an apartment building is because there's an ambulance outside that door every day.
Oh,
And assisted livings, because there isn't medical staff, typically have lived by the axiom of when in doubt, send it out, which makes sense if you don't have medical training, right? If
absolutely.
right, you can't provide medical judgment. You don't have the capacity to provide medical care with the staff that you have.
Yeah.
And so when in doubt, call 911. That is unfortunately the standard. But assisted livings and senior living is very excited about value-based care. And as you said, there's a lot of misconceptions, Sean, about what value-based care means. It's not managed care, as you said, and it's not just doing a great job, right?
Yeah.
There's phenomenal high quality senior living facilities and organizations out there that do a great job that do not deliver value-based care, which, as you know and as you've done, requires a transformation in how we operate and how we deliver care.
Can you tell me more about because now, and I know I've spent time with you exploring this, but for folks who really don't know, can you share with us maybe some of the changes that if we're thinking about number one principle, change management, fundamentally there at these facilities, what change would you consider and how would it make an impact?
Right. So it really is about thinking about things differently, right? And so typically the leaders in assisted living, they are, pride themselves on being able to partner with outside providers that come in and provide care. But those are fee for service providers, just like that Pharaoh, that pharaonic provider, I should say, that are being paid for illness. Again, paid for illness rather than for providing value-based care. So an assisted living, right, a leader in senior living, what they should be looking for is partnering with a provider that also delivers value-based care. That requires a change in the way our mindset. Not just that a provider comes, but that there's 24/7 availability, that there is capability to handle things in the moment. When in doubt, rather than send it out, when in doubt, is your provider going to be on the line immediately to be able to help you decide whether or not that patient needs to go to hospital or not? Are they going to be working with you to make sure that they have all the preventative care they need to, again, to stay out of the hospital? Are they using technology, and are they using different processes to find illness earlier and find infections and so forth earlier, so that we can deal with them before they become emergencies and lead to hospitalization? These are the things that we know work. These are the things that we know help seniors stay at home and age gracefully in place with dignity and with phenomenal care. But when in doubt, send it out. If that is still the mindset, then you are not in a value-based care facility.
You know, Rocky, when I met the team and heard of the concept of Troupe Health, I found, to be frank, pretty concerned about the future of care for older adults.
Mm.
Because if you don't age in place well, what do you think? I mean, as I see it, it's possible that the facilities may not have space to accommodate everyone who might need more sophisticated care by the current system, right? Do you think we're going to have technology at a point where we can safely take care of someone at the house?
Definitely, Sean. And you're exactly right. The residents and the patients inside assisted living facilities, inside senior living facilities, especially assisted living, they would have been the patients that we would have seen in the ICU 30 years ago, right? And it's shocking to say that, wow, that the folks that would have been in the ICU 30 years ago are now in assisted living and living there. We're stretching, right? We are stretching.
Yeah. Yeah.
Whether it be remote patient monitoring, whether it be different processes to ensure that the residents have more touches, that there's more facile communication among not only the provider and the patient, but also the care team that is seeing them 24/7 and knows exactly what's going on. That does make a difference, and that does enable better care. And that does
Yeah.
help us seniors have not only great care, but be able to enjoy staying at home, enjoy that life and have joy outside of the hospital.
I can tell you from a personal experience that it would be really tough for me personally to be with my family at an assisted living facility. That's sometimes there's a cultural component to that, and I would have to, like, just like we did with my dad, we'd have to have him at home, that he wouldn't accept. It's not part of the culture to be able to even consider assisted living. And I would also add to that is that it's stressful when you don't have, if you only have a human without the assistance of technology, it's very hard to feel like you're fulfilling your obligation sometimes as a caretaker to your family member who you want to have like the best care.
Mm.
So I can just from that very small, my own personal experience, I just imagine a future where someone like Troupe Health and the team can make an impact on that population, because really fundamentally that's where it's at, is how do you prove this outcomes? Let me focus on this for a moment. It's have a dignified older adult population, right? And I think that's when I think about what that means is we all know we're going to pass, we know that, but in the process leading up to that, is it going to be an improved quality of life, or is it going to be a challenging quality of life? And I think keeping them as healthy and maximized as possible. I joke with my mom when I tell her sometimes if she goes to the doctor, like, oh, we're gonna tune you up a little, mom. And she laughs about it. She's like, I'm not a car. Like, I know, mom, but still makes you think about it. But it's the same idea, right? Just keep people in the right place, and better is such a positive thing to do. And I'll also add this: what drives me in value-based care, and I've said it many times to folks, is when you're thinking about, I've heard physicians particularly, and I'll call out physicians just because I hear this, is they think it's cheap care. I'm not sure where that came from. I'm not sure where that language came from, but I want to be clear about it. It's not even, it has nothing to do with cheap care. It sometimes through the change process, you actually have to make an investment into the process. And it's about reducing the total cost of care. And I think that's key. And I want to share that before we get off, because that's different. Reducing the total cost of care means rather than having 10 of the when in doubt, send it out, you've reduced that to 4. That's a reduced total cost of care. And you do that with people like Troupe and yourself. That's how it happens. So I just want to throw that in there because I've read that a couple of times, and I'm not sure where that came from, but it fundamentally just a misunderstanding.
That's a really, really great point, Sean. And the fact that, you've done this. A typical fee-for-service primary care practice is spending 15 minutes or less with patients. They're trying to see 40 patients in a day. That is not value-based care. That is fee-for-service. But a value-based practice is spending time, is having more visits, is not just doing an annual visit, and then if you need to schedule, you can see that maybe sneak in for a 15-minute appointment in a couple of weeks or a couple months. Value-based care is being present. It's you're right. It is an investment. It's actually providing more services for that.
Yeah.
More services, right? So that's actually more cost. But how can we say, well, if we're increasing cost, how is that value? Because we just said that value is outcomes over cost, right? If we're increasing costs, how does that increase value? Because what we're deploying in our increased costs and our investments are things that we know drive down outcomes much more than the increase costs. Improve outcomes, I should say, rather much more than the increase in costs. Things that make sense. Things that in the fee-for-service world aren't incentivized to do.
That's right.
Value-based world, not only is it the right thing to do for value, but it's ultimately the best care that you and our loved ones deserve to truly stay healthy. Because it is a lot. It is a lot to care for a loved one that is aging. It can be a big burden. And in a fee-for-service world where you have to transport and take folks all around and see specialists and no one's communicating and you're trying to be the middleman and lack of understanding communication, lack of really focusing on that patient as an individual, it can be impossible to feel like you're doing a good job.
Well, Rocky, if we're done, then I want to say Dr. Rocky Samuel, Chief Medical Officer of Troupe Health, thank you for joining me on the VBC Exchange.
Thank you, Sean. This is a pleasure. Thank you.
Thank you for joining us on the VBC Exchange, brought to you by VBC Plus Solutions. Hosted by Sean Garcia, this series is for anyone interested in the future of value-based care. Whether you're a leader in the field, exploring new ideas, or just curious about what's next in healthcare, we would love to hear your thoughts. Connect with us on LinkedIn and join the conversation. Until next time, keep exploring innovative solutions in healthcare.